beautiful.
Yay! Oh my God, look at that.
That's it. I did not put the pink like I said,
Right.
so I'm
Oh,
going
yeah.
to make the more better.
Wow.
Big difference.
Yeah.
Big difference. Fits your face now.
Yes.
It's the right size. It's the right contour. We are using beauty, anatomy, function, everything all together. This is what it's all about.
Yes.
This has been a journey for
Yeah.
you. This has been a
It has.
really long journey
Almost 2
from your
years.
original surgery, and now you finally have teeth that fit to your face. They fit to. How does your bite feel?
Dr. Brammeier is here with the 8 implants, the top 4 implants.
Yes, sir.
4.
Yes, sir.
So what was the story about the 2 implant failure, right?
So we had 4 implants on the mandible that was all on 4,
Okay.
same day conversion. Upper arch was a immediate denture with extraction of all the teeth. We then did stage 1 placement of the implants, uncovered them, 6 of them on the upper arch. 2 of them failed or were in the process of failing, so we removed those. Colleen is now in upper and lower prototypes, and those prototypes were fabricated by another lab outside of LSK. And I am not happy with the aesthetics, the function, the design. So we have brought Colleen here today with Master Ceramist Luke. Luke is going to go ahead and, with my help, assess the case. We're going to design new prostheses, upper and lower prostheses, that is going to be a fixed restoration. Colleen wants something that's going to be stable, that she can function, chew, clean, whole 9 yards. All that stuff is very important to make sure that this prostheses lasts as long as humanly possible.
So I'm going to take a look at it with a prosthetic, which is the PMMA.
Yes, sir.
And then I'm going to explain how we fix it from the 4 implants. And then, okay, can you come here? So Colleen, any question about any question?
Well, I just want to be able to eat properly. 'Cause-
Properly?
Yes.
You cannot eat properly?
No,
Oh.
they're very uncomfortable.
Such as?
A lot of food and debris get under the
Okay.
prosthetic.
Underneath?
Yes, yes.
Okay.
And just not enough biting power.
I see.
Right.
So what I noticed that, Corey, what I noticed that the huge arch.
Yeah.
This arch is just really fat out.
Right.
So I-
It's hard
you
to
see,
chew.
Look at her face.
Yeah.
It's very skinny and very here. So somebody made it really bulk out. So I'm going to decrease all arch. So this one is involved the occlusion too. You see what I'm saying here? Arch is too far away. It's like that. I have to make like this. Okay. So I don't like whenever she open talk and here it's showing
Right.
the really bulk to me.
Uh-huh.
So I'm going to bring it in.
I think that'll definitely help with eating.
And then she's very skinny type, bite. Midline is off completely. You see here, midline is completely off. You see the nose here is supposed to be there. Okay, midline is completely off. So everything I change it. I think it's picked up slightly open up. And here is like she said, the implant place all lingually. So that's why I offer them. Actually, the doctors wants trying to save some lingual space. The problem is if I make the zirconia, will be very fat. This
Just like it is here.
Oh
Uh-huh.
yeah.
Right at the
Otherwise-
screw
Otherwise,
access.
screw hybrid bar underneath,
Yeah,
and then you make top of the zirconia,
yeah,
and we have to make thick.
got it.
Right.
So
Yeah.
it looks like that.
Sure, for strength.
Oh yeah.
Okay,
Right.
But this is really fat.
Uh-huh.
got it.
You
I
see
agree.
over here, it's really fat.
And Colleen, you were saying it's uncomfortable for your tongue
That was
space.
uncomfortable. The
It is,
pronunciation,
yes,
is
yes.
everything is bad. I hate it. I don't like that.
I don't either. And I tend to cough and choke a little bit because,
Yeah.
you know, if I have too much in my mouth and with the bulk of the arch.
Right, I like the occlusion, but the problem is, you see, whenever she talk, open up, it's really ugly. Who's going to like this? Nobody, right? So probably I have to lower just like this. I'm going to bring it in, make it a little bit higher, and all reset the occlusion, just all frame design. So I have to make the PMMA. This is a big job.
Yes.
Yesterday pretty good. Other dentists, they want I could do hand.
Sure.
This is a big job. So we're going to change these areas, make like this, bring in like this, so make a little bit higher, and then eventually this one, I have to make a little thinner, as much as possible, and then I can change the midline and the whole arch. I change it. So meaning this arch right now like this, I'm going to bring in like this. Arch, bring like this, okay? And then upper, I change everything. Make sense? So I'm going to call to my CAD design right now after we're scanning. And then while you're doing the take it out, so we're going to design, we're trying to finish the PMMA here.
Sure.
Printing.
Today.
That's our goal.
Wow, amazing.
Get it done.
I don't
Let's
get-
do it.
I don't
Let's
get-
go. Let's go.
I'm excited, very excited.
Hey Ray. So this is what I'm talking about. By this good, middle is completely off.
Colleen? Oh, never mind. Sorry.
Haha.
I don't think she's gonna respond right now.
There's a big drop. I'm gonna do part is I'm gonna turn this AI on.
Chin up for me. Yep.
Yeah, the center point is where they meet is my first scan.
Got it.
So I'll try to,
You can give me some feedback as I'm doing it.
just, I'll probably use that one, the posterior doctor, the longer one.
Oh, use a different one. I didn't realize they were different ones.
Yeah, I would probably use medium, let's see.
Try and stay as still as possible, Colleen.
I think we're all good, except on those retromolar pads. You got that pretty good. We could clean that, the rest of that stuff off. Yeah, that one right there on the right side. And that's. Okay. A little bit further back, doctor, if you can.
I think it's about as far as I can get.
Yeah. Okay, I'm gonna try not to get the light in your eye here. And relax just a bit. There you go. And hang on, please. There you go. And close a bit. Open a little bit. Okay. That's okay.
Doing great, Colleen. Breathe through your nose.
Yep. Just trying to, and close a little bit. There you go. I'm gonna go to front, okay? And I'll pull a little bit here. It's okay. Trying to get a reference here. Okay. And close, close. And open. And close a bit. And I'm going to push.
Looks good. Let's look over left. Doing great, Colleen. Just water.
Closer. Thank you. You good?
Okay, so midline is off, right? No, don't change. Yeah. Open up. E.
E.
Okay, so chin up. Midline, I change it. I'm going to change this all arch, bring it in. But before I do that, the lower teeth have to bring it in. The lower teeth is bringing in too. Make sense? Okay. A little bit bite down.
Too much? Open a little bit. Just a little bit.
Hold it down. Here. You want me to tell them?
I'm going to tell them.
I can tell you.
Okay.
Ready?
We're good. I sent you the glass.
Good. Okay, cool. Now my job's done. Okay, you done your job, right?
I'm done.
Okay, I'm going to go to the front. And relax a bit. That's it. And I think you got everything. Okay.
One try. One try.
It's a lot easier.
Yeah.
I just need to click something there.
What do you want me to do?
All right, check.
I think double check. Okay, I got the rate. What is that? Oh, okay, that's good. That's fine. And check. Now we're gonna go to lower. And close just a bit. Close a little bit. Want to do that? something is, we need to rescan this area here.
So,
The scan body is not.
so which is we solved it. We solved the problem that one.
The multi-unit abutments are above the tissue in the anterior, and that's why she's packing. She has limited ridge between the two anterior implants.
That worked. Alright. So I have relaxed the. So of course this is not fun situation. It's tough.
Yeah.
Very sorry for her, but we'll get there. It's beautiful it is. Yeah. It's tough.
Thank you. I'm gonna push a little bit, okay? Relax your belly. There you go. That's okay. I'm gonna pull it up, trying to get the ridge over the nipple. I'm gonna push a little bit. Sorry. Okay, let's see what we have.
So you're scanning your glove, so just make sure you get your glove out of the way
Yep.
when you go to the facial.
And close a little bit. There you go.
Good.
Open a little bit. Okay. Let's see what we have.
Well, that's pretty good.
Trying to make sure I got all the ridges.
Right.
Are we going all the way back here, Doc? We're going all the way back here? Oh, yeah, I gotta get that one. I gotta get this.
Yeah,
one.
all the way back, all the way back. I need the ridge.
Ridge.
Yeah, I just need this and this, that.
Yeah.
Both sides.
Yep, yep.
That's the
Especially
toughest.
patient
Yeah.
left side.
You
Right
have
here
to get the
and right here.
retromolar pad all the time.
This is a music technology.
Oh,
Yeah.
Wow.
better.
That's perfect. There's only 4 of them there. Cool. You want them short one again?
That good?
Yeah.
Okay.
You could, yeah. If they could just meet right in the center, in the middle, it'd be perfect.
Used to play a lot of Legos back in the day, so this is perfect.
Yeah.
Building smiles, Colleen. Building smiles.
I don't know how far the other one is. Oh, it's close by, so we could use this. If I'm a little too fussy, doctor, can we have the longer one kind of tilt in this way? Bring this one?
This one?
Yeah, a little
Yeah,
bit closer.
sure.
Thank you.
You can be as picky as you want, man. You can be as picky as you want. I'm super picky. That's why I'm here.
Well, you have to, I guess, yeah. All right. I'm set for that.
Show all the way tight.
Yes, sir.
Yeah.
Almost there.
Uh-huh.
Yeah. And that one, yes. Thank you.
There?
Yeah. A little bit towards the rest of the group. Okay.
All right, what do you want from me?
They're tight. And
Doing great, Colin. Distal ones, you want the longer scan bodies?
Sure. So long that they meet pretty close to each other from the center, somewhere in the center. Yes.
It's too low.
This one did not manually set.
Colleen, I'm gonna bring you down in the chair and bring you a little bit forward.
okay.
And first of all, the ornament is much easier for photogrammetry.
Mm-hmm.
Just notice that.
And we are good on that one. Now I just need to.
Do lower?
Nope, nope, not yet.
Okay.
We'll do one more scan. And I need to reference this to the ridges, the scan bodies. And relax, relax.
Got it.
Double check. Okay. And coded scan body transfer. Do you want to transfer? Yes, I do. And transfer is good. Check. Okay.
Yes!
We are
Let's go!
ready for.
Let's go, Luke. Let's go, man.
What he did is nice job.
Let's get some teeth. Lower. Oh, go ahead. Yeah.
One more run here, Colleen. Something went cuckoo. Okay.
You know what I want to do? I want to do, after we're done, okay, I'm gonna bring her back, like totally done. Finished, and we're
Okay.
finished. I'm gonna pay my stylist, okay, who does hair. And then that, she does hair and makeup. Okay. She's gonna come in, she's gonna do before that.
Can I close a little bit? Want to pull your upper lip a little bit?
What'd you guys hear?
And I'm gonna stretch your lip here.
This is gonna be. So, this is bulky. This is bulky because it needs to be.
Oh, this is.
Straight.
There you go.
This is bulky. Yes. Everything's all facial, it looks too bulky. She should top of it.
Too short is okay.
Too short. It's okay.
It's
Too
okay.
short's okay?
That's good. Yeah, it's okay.
There's not much precise for this precision.
The dots are the precision.
Yep.
Yeah, so which is more easier.
Got it.
All I care about really tight and do not touch each other.
Yep. Got it.
No, you're good. You're fine. You're important.
So far, so good.
Yeah.
Doctor, here's one more if you need it.
Yes, sir. I'm just checking to make sure they're all seated.
I got it. Oh, okay.
Oh, I'm sorry.
That's all right. It's
I
black.
can't see anything. These here telescopes.
I hear.
I have just a blind spot. Like if you have something over here, I can't see anything over here.
We're almost there. So after we did it 5 minutes, and then we can put it back to the temporary.
Got it.
You don't have to screw at all 5 or 4 in, so maybe 2.
Okay.
And then after 1 hour or so 1.5 hours maybe. Okay, so this is the long span panic and then upper. You can change this.
Okay. Great color, super still.
Sorry. Stay still. There you go. And I'm just gonna go here. Push your tongue out a little bit. Okay. And I'm going to the front. Close a little bit. There you go.
Doing great.
Almost there. I'm sorry.
More macro.
And
Most of the problem is not dentist job or aesthetic and occlusion because they don't know much. Because I see the teeth, we make 35 years every day for mouth, right? So my heart is there. So I want to make a really detail compared to the patient status. So that's why we can offer it. Otherwise, why you pay more? It doesn't make any sense.
No.
There's a lot of lab out there.
Yeah.
You know, just come here,
Yeah.
do it. Okay, I'm a dentist. You're the lab guy. Just do it, right?
This is all in the same location,
Right, that's
having the
wonderful.
ceramist
Right.
in the same location
That's
as the patient
Yeah.
and the dentist. We can design.
So,
This is the triangle
custom.
right here.
Custom for your teeth. It's not only comfortable, make your confidence.
Yes.
Just like your teeth.
Yeah.
That's it. That's why you pay for.
Right.
Remember, that's it. That's my job. I'm trying. Sometimes 5% I have a limitation,
Uh-huh.
but I can improve this one more than 80%.
Wonderful.
You can see day and night. But gum.
Okay,
tissue.
okay.
Hold on.
Oh my gosh.
Hold on.
Chin up for me. I'll tilt you back a little bit more. Chin up a little bit.
Oh.
So now this temporary after I change it, the all prosthetic the design from lower tears and then upper tears and then narrow the arch form and bringing in the lower to get the occlusion contact. And then patient upper left to right side was really bulky.
Open real big for me,
So
big
I'm
as you
moving
can.
this really,
Doing great.
really thin and to make more narrow down. I did not put anything about tissue color yet here, so don't judge the pink color, but this is kind of more white teeth is there. I just want to double check the prototypes and make sure the oral occlusion is correct with Dr. Brammeier, okay? And okay, upper's done.
Okay.
Looks good. So I'm going to call the guy so we can scan one more time and then much improved. Much improved it and okay. Yeah, here,
Okay,
here.
got it.
I can cut it. I can cut it here.
Okay.
No problem. I cut it down. But that one is day and night. However,
yeah.
however, I see more, so I can cut more here. I'm so glad I fixed those things. I'm so glad.
Oh,
Oh yeah.
now you have more tongue space, right? Your tongue can rest down a little bit more.
Yes.
Okay, so Cody here. Oh, you like that? Okay, okay. I can show you from the bright. So we call celebrity smile. Too bright to you, right?
What do you think?
It's up
Yes.
to you.
It's
Follow
I
your
like
heart.
I want opinions because
Got you. So whenever I go to, can I take off?
Yes,
Take it off.
yes.
Hold on 1 second.
okay.
Eye, bigger eyes. I follow the eyes color. Follow the eye colors. Yeah, something.
three?
Yeah, something this color. Then like not unbalanced. So if I choose white, then is everybody noticed?
All right.
But your eye color tone and then teeth color tone kind of little similar matching it, and then that was look more natural
Right. Okay.
color. Even CSB4, this one.
Mm-hmm.
You know what I mean? Okay.
I like CB4 a little bit
Yeah.
because any yellow that you add of the dentinal color is going to make it more natural.
Yeah, CB4P. What do you
Four.
think? You like that one? Now go.
You don't want any
follow your heart.
Give me white teeth.
Yeah.
Baby, I love it.
CB3.
I love it.
Okay. Yeah.
Yeah.
Did you?
Fabricate a top of the line restoration for you, and not a solid zirconia restoration.
So this is the Rosen screw, and so no tie base involved. It probably Dan Rosen, Dr. Dan Rosen. We're going to like it. Make him so. And then this is a Prit corporation, which is called the Implant Buddy.
Open real
So
big.
you can let him know the implants. They are so core. So Prit, P-R-E-A-T corporations. So they sponsor us, and let them know, which is Chris Bohm. And then he sold his business, but long time ago. You know, now he's a freedom, but he's still in the dental field. And almost there. Yep. I think, yeah. So there's one, then we get the better, just type is a little bit better. Now is we're going to check the occlusion contact and arch form, and then have our talk, and then we can see there's much better idea for that. And
All right, it's in.
all right, hold on. Can I have a mirror?
Yes, please. I'm trying to see here, but I see my legs. Whoa. Ah.
Teeth.
Oh my goodness.
Beautiful.
Yay. Oh my God, look at that.
That's it. I did not put the pink like I said,
Right.
so I'm
Oh,
going
yeah.
to make the more better.
Wow. What the-
Big difference.
Here.
Big difference. Fits your face now.
Yes.
It's the right size. It's the right contour. We are using beauty, anatomy, function, everything all together. This is what it's all about.
Yes.
This has been a journey for
Yeah.
you. This has been a
It has.
really long journey
Almost 2
from your
years.
original surgery, and now you finally have teeth that fit to your face. They fit to. How does your bite feel?
Great. I
Does
only
it
have
feel
that-
even now?
Yeah, I only have that thing,
Yeah.
you know.
So
Look
here-
at what you had. Look in the mirror. Look at what you had before.
So here's
Look at the difference. Look
so
at.
without pink eye nose, I'm
Right.
talking about the the arch form
Right.
is too wide, but I make narrow.
Right.
And then here actually here is more is really ugly here, right?
Right.
So I decrease as much as possible. You cannot see much.
So
That's
you
why I
can't
like
see
that.
the screw at what he's talking about.
All right.
You can't see the screw.
No.
holes.
Before they can see
Oh,
everything.
my
That was
goodness.
totally visible every
Yeah.
time you.
Yeah, open
so
my mouth.
now when people look at this, they're
Right.
not gonna know
No.
that this is something that's
Right.
false.
Right.
So my challenge was this: I just videotaped my designs. I decreased the or forward the not forward is backward every teeth, and then make narrow, and then this is maintained because the head is there, screw head, so I can bring down, and then I finish them up. You see, it's beautiful that one. But remember, I did not put the pink yet. No time, patient waiting about 4 or 5 hours already. So I'm going to finish them up. I don't mind. She can wear this.
Yeah.
If she doesn't
Oh,
mind.
I
can
rather
give
wear
it
the.
There's no way she's not walking out of here with those
Oh,
in.
sorry.
You know what we can do with those? We can have
Yeah.
a ceremony. We can
Yeah.
go outside. We can
Yeah.
get a sledgehammer.
Yeah.
We can destroy those. Okay.
So now the other one.
We
is-
probably want them as a backup, but you know.
No,
So,
no, I
so
don't.
the other one is I'm going to add probably one more teeth here. I think it's okay with the here, only 10 unit.
Yeah.
And then I can add probably a little bit more here. So
Yeah.
to get the better
Molar, 2 premolars and,
and then
molar.
that's it.
Yeah.
Yeah, so
Great.
lower pretty good.
That's great.
Okay,
Wow.
now I'm going
Yes.
to check the occlusion with the Dr. Michael.
Wow.
And we just make sure all the collaborated and make sure everything's right in contact. Then we can do define and fabricate more detail. So like I told you yesterday, I make real detail, make look like teeth. Right now, Corey will go and take we can coloring with the color and digitally done, and then we're good. Now we took the horizontal. This is what I'm talking about, Dr. Michael. You can take a look at it. So we do horizontal, and then
Oh.
this is what I'm talking about, yeah. And then we just have the file.
Yeah. Do you want to retract it or?
Yeah, can you retract?
Yes.
Oh, those lovely retractors.
You're
I'm
gonna
gonna be done with
be. You're gonna
these.
be so ready to be done with
We're
these.
almost done, just a little bit.
That's good.
Not the bite.
Close just a little bit.
Close
Bite all the way?
All the way, yes.
There we go.
I'm slipping. Open a little bit here. Open.
Okay,
Yeah.
do all the way.
Yeah, it's pretty close.
So let him do. Let AI do it.
Mm-hmm.
AI choose the darker one. See, I'm
You
right.
chose CB4.
So here now,